The Special Olympics Health Program has provided athletes with access to high-quality, informed health screenings for decades. But within the last 10 years, it's homed in on a few key areas, including creating a system that's more equitable for people with intellectual and developmental disabilities, also known as IDD. However, Dr. Dimitri Christakis says the organization has realized that to truly make an impact, they need to address this issue for all people with IDD, not just athletes.
Special Olympics has 600,000 athletes in the US, about 6 million globally. But that's a small fraction of people with intellectual and developmental disabilities. Even if we were in the business of being healthcare providers, which we're not, we're merely screeners, our organization doesn't have the bandwidth to solve this problem. It needs to be solved by healthcare systems and by societies themselves. And it can be, it just historically has not been a priority.
Christakis is a pediatrician and the chief health officer at Special Olympics. Special Olympics reports that, on average, people with IDD die 16 to 20 years earlier than the general population due to unmet medical needs. Christakis says many of these conditions are preventable or at least manageable with timely access to effective care. In an effort to improve health systems around the world, Special Olympics recently published a global report that focuses on 11 sites in 9 countries. The paper first assessed the current experience people with IDD have in these different systems. While some countries do a better job than others, Christakis says they all have gaps in care. The global report shows that most people with IDD don't make their own health decisions and only about half always understand their healthcare provider. He says that in the U.S., a driving factor of these challenges is our current reimbursement model.
Doctors in the United States are reimbursed by and large, according to the condition that they are treating. So if I am a dentist and I am seeing a child for a preventive dental visit, I'm paid a fixed amount, whether that child is neurotypical or whether that child has intellectual and developmental disabilities. And the fact of the matter is that it takes longer to do a preventive visit on someone with intellectual and developmental disabilities. It takes considerably longer if you spend the time needed to make sure you deliver it in a respectful and compassionate way. And yet the reimbursement is not commensurate with that additional need. And what that ends up creating is a system where there are many dentists and many doctors who simply choose not to treat people with intellectual and developmental disabilities because it's not as lucrative.
But the problem goes even deeper than the financial aspect. Christakis says there's a huge lack of training for healthcare providers on caring for people with IDD. Sadly, this is an issue that spans generations of physicians.
I finished medical school over 30 years ago, and I got no training. I got no training whatsoever in the care of people with intellectual developmental disabilities. I got all of it when I started practicing medicine as a resident. Sadly, it's still the case that fewer than 50% of medical students get any training in the US in the care of people with disabilities. That's all disabilities, not intellectual and developmental disabilities in particular. So you're not adequately compensated. You don't feel very well trained. It shouldn't come as much surprise that there's a paucity of doctors that are willing to take people with IDD. And when they do, they don't do as good a job as they should.
David Duncan has experienced this incompetence firsthand. He began competing in the Special Olympics in 2012 and is now the chairman for the Global Athlete Leadership Council. Duncan's been steamrolled by dentists who refused to believe he was telling the truth and at times ignored altogether.
They would explain it to my mother because they assume that I can't understand. It's something that I may be struggling with. So if they're doing a procedure and I'm feeling a lot of pain, I tell them that I'm feeling pain or I make a sound. They just think, oh, he's special, so he doesn't know what he's understanding. Or this procedure normally say, I guess it would not hurt a person without IDD, even though I think it would. So they think that I don't know what I'm saying or experiencing.
He's since found one he trusts who takes the time to fully explain any situation and answer Duncan's questions thoroughly. There are still times when he has to advocate for himself, a skill that he's worked hard to build over time.
When I was younger, I used to shy away from certain experiences because I realized that persons didn't want to speak to me because I have a speech impediment. I don't always speak clearly, and sometimes I feel that I'm just some sort of alien. So I want to stay by myself, but I have a younger sister. She's passed now, but she used to speak up for me.
Duncan says he got a lot of strength and confidence watching his sister advocate on his behalf. And as he got more involved in Special Olympics, Duncan continued to build the courage to speak up not just for himself, but for his peers as well.
And I learned that my voice matters. So Special Olympics opened my eyes to that a lot, that I can use Special Olympics as a platform to advocate for persons with IDD.
That's not to say that guardian advocates aren't important, but even when a guardian is present, people with IDD should be given the respect and dignity to have agency over their health. Unfortunately, Christakis says this advocacy from any group isn't enough to create the needed change.
They're self-advocates and then they're guardian advocates, and both are important. But sadly, they're not sufficient by themselves. Advocacy only gets you as far as the person you're advocating to is willing to let you go. So it has to come from both places, from both entities, from people with intellectual developmental disabilities and from the larger healthcare system.
The good news is these changes don't require a complete overhaul of our system. Christakis says people with disabilities would have a much different experience if our healthcare system simply prioritized properly training primary care physicians.
1 in 6 children have a developmental disability in the United States. So it's hardly rare. It's more common than asthma by far. There's a lot more training for dealing with asthma than there is for treating people with intellectual and developmental disabilities.
In an effort to lead by example, Special Olympics offers opportunities for physicians to receive this training by volunteering in the athlete screening programs.
We take physiotherapists, podiatrists, pediatricians, audiologists, ear, nose, and throat doctors, and we train them in the care of people with intellectual developmental disabilities. They come to our events, they screen our athletes, they see how wonderful they are. They get, in many cases, their first in-depth experience to the care of people with IDD, and they leave as better clinicians for caring for that population.
The program has trained more than 300,000 providers and students in 60 countries. And though inclusive care is strongly advocated for by the disabled community, Christakis says it's something that will enhance every patient's healthcare experience.
The thing that I think we don't appreciate enough is how, when we make society work for people with challenges, we make it work better for all of us. And let me use an example outside of healthcare for this. So if you put curb cuts in so that people with wheelchairs can access sidewalks, people with bicycles can do it, people with walkers can do it, toddlers can do it more easily. Everybody, in effect, benefits. So with respect to intellectual and developmental disabilities, one of the things that they need is things to be explained to them in a way that's more readily understandable. One of the biggest complaints that everybody has with their doctor is that they talk over their heads. Some people complain that they are too condescending to them, but the bottom line is doctors need to learn how to communicate better to the patient that's in front of them. And teaching doctors to speak in plain language, more importantly, teaching doctors to be attuned to how well their patient or their patient's family understands them is essential to people with intellectual and developmental disabilities, but it's absolutely beneficial to everybody.
The Special Olympics Global Report is just the first phase of evolving health systems all over the world. Now that they've collected this baseline data, the organization is now partnering with each of the 11 sites to see what changes will be the most impactful. Those sites will ideally turn into case studies for other health systems to model their own practices after. You can find more information about Dr. Dimitri Christakis, David Duncan, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.